All right. Well, welcome to the summer Qredible broadcast. We're so excited to have Ryan Guzall back, excited for a repeat appearance and to hear from you today. So welcome, Ryan. You want to tell us a little bit about yourself, remind us who you are and GreenJeans and all the good stuff?
Yeah, sure. Thanks for having me. So I am the co-founder and CEO of GreenJeans. We are a product pairing platform. So we pair the right person with the right product at the right place, time, and price using human and plant genetics and AI. And now we have a little bit of an incentive in there as well. Anywhere it's legal, we have manufacturer rebates. And we actually found a way to make this legal in all states, including New York. So we're the only ones to actually do that. My background, very strange and interesting, I think. I started out in biochem. My dad owned a laboratory. My mom was in the lab for about 40 years. I went through a program at Michigan State, came out the other side with 2 degrees in HR and one in supply chain and MBA. So it has nothing to do with what I started in, but I at least had the functional knowledge to be effective in the role where you're trying to pair genetics on the plant side with the human side and then also understand the business. So that's a synopsis of me.
And welcome to the world, the wild world of cannabis, and and welcome back to the show. It's great to have you here.
Yeah, thanks for having me back. And yes, it is most certainly wild. We're having a bit of offline conversation about some things that we see and experience that we have not seen and experienced in any other venue to date.
Yeah, no, I feel the same. It's like it's really important. We've always talked about it. It's important that folks from the outside sort of come in and add their expertise into this industry. It's so critical. I was watching this LinkedIn post grow significantly over the last couple of weeks about this exact topic. And people were talking about how important it is for folks like us to, come in and provide a different perspective, because we're generally newbies. But when you look at it, the industry is very new, right? So it's good. It's great to have you in the industry and another creative mind and good technological thinker and creative thinker in the space.
Well, thanks for having me. I appreciate it. And I should also say that while I was at this Michigan State place, I was a director of business development for an institute. It was a public-private partnership. So we commercialized or tried to a lot of technologies, and I was able to work in a bunch of different industries, worked with big tech, big pharma, and advisory on the human resources side, and then also on the supply chain side. So like you, yes, I have a lot of insight into a variety of different industries, and cannabis is certainly the Wild West.
It is, and it's funny. You've got that pharma experience, and in the world of pharma, like quality assurance is like job one, because of this highly regulated industry of big pharma. In fact, somebody was saying to me the other day, I was talking to an investor. He said, "Well, like what happens when, cannabis goes federally legal? Is Qredible done?" And I said, "No, we're just getting started. This is the moment we're hoping for, because at that point, quality assurance and, driving quality standards in the industry, it's not going to be a nice to have. It's going to be a need to have, a requirement. And it's going to be a really a standardized effort across the entire United States, which is really what we're trying to get to. So, Qredible is really all about driving quality assurance. And the work that we're doing is, I like to say, and Joy's heard this even in all of our marketing, that we're putting standards in action, right? It's really about finding what those standards are. And everybody talks about writing standards, but the real thing is quality assurance standards are nice to have on paper, but unless you are integrating them and putting them into action, into your actual systems and business processes, they are absolutely meaningless. Mm-hmm. So we are really focusing a lot on that message. And sometimes I feel like I'm talking to the wall, but and to be fair to a lot of the companies in this industry, they're dealing with so much. They've got market access problems, right? They've got 280E problems. I mean, let's start a business where all of our revenue is taxed, and you cannot take any of the benefits of the IRS deductions, but yet the IRS is going to have their hand out for 100% of your sales, but they're not going to give you the benefit of actually writing expenses off. So it's a very difficult operating environment. And then you've got, all the, like, these multi-state operators, they're dealing with all these different states, and every state has a different idea of what quality is, and, what should be tracked. And they've got to keep, track of that. I was just talking to a friend yesterday who just took a position with a multi-state operator. I said, "Oh, you're going to be their national head of compliance?" He goes, "No, I'm handling 2 states. They've got other people to handle other states." So literally, this company has a compliance person pretty much in each state, because that's, I mean, it's really, it's really crazy. But what we're really hoping to see in the CBD, hemp, and cannabis industry is these good manufacturing practices and these standards starting to be put into work, because now we're hearing about the headlines. So anyway, I'll get off my soapbox about that, but standards in action is absolutely critical. So you've heard what I think the issues are. What problems are you seeing in the markets that you're really involved in?
Well, why don't we stay on that soapbox for a minute? We're both members of ASTM,
Yeah.
and that's where we initially met. So you're talking about standards and standard setting and having the right people in the room and discussing the necessities. But it really comes down to, implementation and actual enforcement, and then standardization across the different states. We deal with this in a variety of different fronts. We have trim force as well, so we staff a lot of people. And when it comes to staffing, there are different rules for staffing state by state. So this is something that isn't really considered ever. People are usually the last thing considered. You learn this in HR, which is unfortunate because of the most important resource you have. So even in dealing with the industry on that side, it's very difficult. But when you come to the scientific side, there are standards and there are parallel industries, and you can look to alcohol and prohibition, where we went from there to now. You can, anticipate where this industry is going to go next, and you can mirror the standards that are in place, and also look at distribution networks, how that works at a state level. If they are going to reschedule, how you're going to be able to protect the farmer in the state who's been growing for a year and a half, as opposed to doing international trade right off the bat. So the issues that I'm currently seeing, they're more on the scientific end, because that's where we're operating today. So some of the things that I noticed recently were naming conventions, specifically in terpenes. So, with GreenJeans, we pair the right person with the right product, and that's based on the terpene, flavonoid, and cannabinoid profile of whatever product we have on the platform. So when it comes to naming conventions, you're taking these name titles from the laboratories that are running the tests, the GCMSs, and whatever results they're pumping out, they're putting it under certain headers. Now, all the chemical elements are the same, but the way they report them might not necessarily be the same. So you might have, like, endophensyl alcohol versus benzyl, myrcene, or that's an interesting name because it's said wrong, and I say it wrong as well. Myrcen is the way it's supposed to be said. So
It
Myrcen,
sounds very French.
we. So yeah, but looks like myrcene. People say it different ways, but myrcen, and then there's beta myrcen. So certain labs report myrcen, other ones report beta myrcen. Nobody reports alpha myrcen, because alpha myrcen is not naturally found in nature. So this, unless it's developed in a laboratory and added to a product, you wouldn't expect to find it. However, we also have artificial terpenation now. So you would eventually expect to find this in a product that would be consumed by someone maybe at a point of sale or beyond. So naming conventions, that's a big issue. When we get to the larger scale, I mean, it's difficult to figure out where to start, because was recently on a tour of New York. We were onboarding quite a few retailers and some more growers to the platform. And I stay usually half a day at least with each one to see what is their daily process. I am also on the process improvement side as a supply chain guy. So I like to monitor things and just see how people interact with each other and the way things work, and see if you can make a recommendation to improve the process and maybe more efficient. You save money, everybody's happier. So seeing the current processes, they are so disparate, and there's so many different technologies that are in your face that are supposed to be making things easier that make them more difficult. And if we focus for a second on retail side, so when let's say, grower comes in and they have a sales staff member that wants to sell you a product, they're going to have 5 different ways to sell you that product. Point to it on this screen, write it on a piece of paper, I'll take it back. Here's a spreadsheet, call my guy, text somebody else. So this is a major problem that exists. There are certain solutions, but the solutions are extremely expensive. And those are usually coming from developed markets that have crashed, 2, 3, 4 times already. So they also pass the cost almost always along to the grower, the one least likely to be able to afford it. And the retailer gets away free and they don't have to pay anything. So I think one of the major issues is the cost and risk sharing throughout the supply chain, because we get back to 280E, there are ways that you can figure out how to do that cost sharing from an accounting perspective so that it is legal, so that you are sharing some of the burden with each other in certain agreements. But people don't get to that stage because despite the fact that this is supposed to be more like a buddy-buddy relationship in this industry, which is the way it seems because they had a legacy market and now you're into a developed market, those relationships don't maintain over time. And especially when it comes to the MSOs, you see these are guys from other industries, big tech, big pharma, they have a lot of money. VCs are dumping cash into their pots all day long. They have different standards and they don't usually work well with the guys that come from the legacy market. So you see a big chasm that develops there. But when you're thinking about rescheduling and you're not targeting standardization and efficiency, and you are the small farmer or you are the legacy market grower, you're going to have a big problem when the big guys come to town and they're looking to acquire the ones that are most efficient and effective.
Well, I think the only thing that could bridge that chasm, right, is the quality standards that are put in place, because you got one group thinking one thing, one group doing another thing, and quite frankly, it's just all over the place and it's crazy. So standards really are standards in action, and these regulations are the only thing that could really bridge that gap to safety, as far as I'm concerned. And I'm really interested in something you said about this this naming convention, because I mean, just in full disclosure, the products that I use a product to sleep. So it's basically a gummy. It's got some THC, some CBD, CBN, CBG in it, and it works really well. I get a good night's sleep. So I'm not of the smoking variety, never really have been, and will never be. But when I look at some of the smokable flower out there and I see these names, I mean, like blueberry haze and, dragon, what it is.
I do. Yes, swear words and it's a bouquet.
So it's like, what, I mean, and then it's like, we've talked about this before, then it's just like, well, is that sativa or is it indica? I mean, meanwhile, and then we start breaking out terpene names and we start talking about all this other stuff. I mean, we're going to need literally a roadmap to help consumers figure this stuff out. And if we're going to be safe, we also need to be transparent. So, what are your thoughts about how we would use like a standard nomenclature, right? Regardless of what the flowery marketing name is, because some of these people, I feel they've been sitting in a room smoking stuff to come up with some of these names. I mean, they're really creative and fun, but the fact of the matter is, like, consumers are going to be confused. So I know there's these different varietals. But what does that really mean? And how do we standardize that in a way that drives transparency to a consumer?
So from our perspective, first of all, the naming conventions you can throw right out the window because those are just marketing tools in general and they're relatively arbitrary. If you get a pink runts from one person, depending on the genetics and the growth standards, it's not going to be the same as getting it from another person. And especially now, considering the era of artificial terpenation of the product, you really don't know what you're going to get. So they can be sprayed with whatever kind of terpene you can buy from any of these laboratories that manufacture them. And you can call it pink runts all day and then spray it with, camphor, and it's not going to taste like pink runts. It's going to give you also a completely different effect. The standardization side is something that we've worked on. And maybe this would be a good conversation for us to have offline about laboratories, because I've been in laboratories my whole life. I've worked with laboratories, visited a lot of them up here in Michigan. And we know the good ones and the bad ones and who do things properly. So we try to work with them And we specifically started working recently with a brand called Vape. So these guys, Brandon Byrne, he was a close friend of mine, coming out of the program over at MSU, we worked together for a bit there, and their company is doing pretty well right now. Their brand is phenomenal, but they focus on the terpenes, which is the most important thing to them, as is with us. So they're onto the entourage effect, and how do you feel overall as the individual when you engage with these different terpenes? Well, I think, focusing more on that side of the equation, and standardization is not really going to be that important for the consumer. They don't care. What the consumer cares about is, what can I relate to immediately, recognize off the bat? Do I see next to the point of sale that I'm going to have this type of experience with a product?
Yeah.
And how do you create a matrix to do this? This is something that we worked on. So I ended up developing a couple of different matrices for flavor profiling, and then also experience profiling based on the literature that is currently out there and the experiences that are reported in the market. So, for example, Mersenne. So Mersenne, we can get back to this exciting French one.
Oui.
Yes. Their profile for Mersenne, if you look across, a variety of different interactions people have had, they report citrus, peppery, fruity, earthy, musky, and mango. So these are the different elements for a Mersenne. So
No
if you
fromage? There's no fromage in there?
no fromage, no creme fraiche either. So their experience from a flavor profile perspective is going to be the same relative to the percentage of that terpene that you find in the product. So if you're smoking flower and you can isolate that terpene, or you have just pure terpene, that is the experience you're going to have. If you can focus on that, instead of trying to educate the consumer about, here's a list of, we currently monitor 58 terpenes. So if you're monitoring these 58 terpenes, consumers don't care. And quite frankly, if I were to walk in and, I know maybe a third of them by name, and I certainly don't know what the effects of them are offhand, and I don't know what their flavor profiles will be. And especially if they're going to be combined, I have no idea what that outcome would be. So created a program that visualizes those things for the consumer. So when you go to the point of sale, or you're next to a display case, you can see a digital banner that'll show the current products that brand has, and the overall flavor profile, to say this one is most woody, this one is most earthy, the next one is, most citrus, and give you a nice chart that'll show you the flavor profile experience you can expect to have. And then also the terpene effects that you can also expect to have. So a similar matrix. The issue with that is the genetics component. So how do you really engage with the product from a genetics component? And I don't know if I mentioned this during the last podcast, but during the research, discovered that I have a single nucleotide polymorphism that prevents me from I don't have the enzyme to process CBD into its active chemical component in the body. So you can give me all the CBD you want, and I'm not going to have pain relief, let's say, from it as a normal person would. So individuals, let's say from APAC region, are going to interact with products much differently than people who are of Nordic descent. And when it comes to the mixing pot of the US, we have no idea. And the utility of the GreenJeans platform is trying to figure out how all that works based on people journaling and reporting how they actually engage with the products. Now, the Vape and Ape relationship has been really good. We have products on the platform that have been subsidized, so people can go to points of sale in Michigan. We also have brands that are on board in New York as well. So if you go to mygreenjeans.com, you can have the full user experience. But in the Michigan market, if you are buying these products, they have terpene profiles that you will engage with, and then you report how you've engaged with these different products. And that better informs the manufacturer who in the market is responding to these certain products, and also then better informs their sourcing of genetics and their production planning and a variety of different elements of the business.
All right, now that's really cool. And Qredible, by the way, has just released a really cool technology called My COA. And what my COA really is about is it's the blockchain. So it's the ability to connect your lab. You can connect it electronically, or you can just email to the blockchain. The blockchain picks up the lab report, and ideally, we're taking the data from the LIMS system that they're passing along in the payload. But if they're not, we have automated, platforms. We've got machine learning, artificial intelligence that's essentially pulling data off of those lab reports, of the entire profile, everything that's been tested, right? Now, what's really unique about that is you don't need to use our e-com solutions to do that. You could literally plug that into whatever point of sale, whatever web system you're using. So your transparency to your customers, it's like you don't have to swap out your websites. But what you and I are going to talk more about on this is connecting those two technologies, because now what we have going on is we've got all that data. We've got the blockchain repository. We're connected to all these labs, and getting that next level of information to a consumer, we're certainly not going to build. You've already done that, right? And you've done a great job at that. So, and you're continuing to amass all this data, and which, by the way, data plays an absolutely crucial role for not only quality assurance, but transparency and the kind of things that you're doing. So, the reason in connecting, those two together is, first of all, we can use that data for quality assurance and testing, but we can also use that data for transparency. And that's where you come in. So I love what you're doing here, because I think it's absolutely critical. And ours is just a modal. It's a plug-in, that can plug into any point of sale quickly. I mean, literally within 20 minutes, you're integrated into it, and now it's blockchain. The only problem, and I've said this before, and you and I will have lots more discussions about labs offline, but I've always said that, if you vault garbage, then it's still garbage when you open the vault. So, you have to make sure that what the lab is doing is, they're not monkeying with THC levels. They're not, falsifying anything. Again, not that any lab would do that, but we
Never.
know never. So the thing is, and what we definitely can guard against is, obviously, once that comes directly from the lab, and we are working with some great labs that we know that really are about transparency. They're about making sure that this stuff's done right. It connects to our blockchain, and then once it's in the blockchain, you can't monkey with it. But we have all that data, and what we can do with that data from this quality assurance and transparency perspective is critical. So really, really important. So, talk a little bit about, sort of, how you see this evolving to really help these consumers understand, this, and what are there any barriers that you're seeing? What are the roadblocks that you're facing? Because I know what you're trying to accomplish, and I think you're making great strides in doing it. But what are those roadblocks that you really need to plow through?
Well, provenance is one that you're solving. This is a major issue with laboratories, not just the quality of the work they're doing, but whether or not the results are true. So I've seen false reports. There's a guy in ASTM who worked on this as well on the blockchain side, putting together a little bit of an international standard. I think I worked on that a little bit with him, but it's
By the way, we're now plugged into that side, so they're sort of bifurcating the blockchain to be a specific lab standard versus the blockchain that was going to be like for transportation and the bill of ladings and those types of things. And they are completely, they are really impressed with our standard on the lab side, and really, really bright guy. We're probably talking about the same person, but we're actively involved in those ASTM standards. It's important work that they're doing, but getting it right, again, a lot of this stuff gets lost in the action, in the implementation. So we're not waiting. We have already put that into action. We have already made that happen, and we've spent, frankly, millions of dollars to get to the point we are, to actually stop talking about this stuff, but actually put it into action.
Yeah, and I think user adoption is a critical issue, and it doesn't just apply to the consumer, but also to the business side, especially the grower who is incentivized to go with the laboratory that's going to produce inflated results and not use a blockchain or verified, technology.
Unless it's required.
Right. So I'm fortunate in that I had the background that I do, and I can recognize things when I tour labs that should or shouldn't be there. And I know, certain processes for homogenization that will result in inflated, THC results. So when you are, at least when I'm onboarding new labs and working with them to determine whether or not we can ingest the data from their COAs, I know what to look for. And that's extremely rare in this industry. I know you've been to these ASTM meetings, but this is like a very extremely small subset of the industry that operates at that level and understands the intricacies of laboratory and clinical laboratory testing, coming maybe from the medical side and the CLIA side. You have microbiologists and biochemists who have been doing this their entire lives. And it's great, to be in those meetings and listen to the scientific side of things. But to translate that to the public, first of all, this may be a shocker, but the public doesn't care. So you can't force the public to care either. And that's, I think, one of the holes that a lot of teams I've seen in working with, tech commercialization and academia fall into. It's, well, we have to get out there and educate the public on why this is so important to do. No, the public doesn't care. They want to go home, and so do I. I want to sit at home and watch, Jeopardy and relax and have a good time. I don't want to be inundated with, here's another lecture, attend my lecture, look at my slide deck. I don't care. I've had enough all day long. You're looking at decks and learning things.
Now help me understand, what specifically don't they care about?
They don't care about learning about, terpenes.
Right. Okay.
It doesn't matter. I don't want to know what a flavonoid is. Cannabinoids, that's only somewhat relevant when you get to, well, how much THC is in this product. But the interesting thing,
but do you care if it's going to make you sick?
Yes, you should. But there's also an element to that is somewhat misleading. So when you have the COA for the product, we're talking about the raw material that not necessarily is going to be sold to the consumer, depending on the market you're in, unfortunately. Now, I'm also I'm not a user. I don't smoke. I don't do anything. I don't consume. However, I will under certain circumstances. And I did recently 2 times. The first experience I had was.
But you didn't inhale, right? Wasn't there?
I did not inhale. No, I did chew and eat it.
Just going back to Bill Clinton.
I
I
know.
didn't inhale.
So I had an edible when I was in the state of New York, and it's manufactured by Ravensview Genetics. Now, their products are phenomenal. They use land-raised genetics. They use all pure ingredients, and they're borderline micro dose, like 2.5 milligrams per edible. And for a person that doesn't use anything, that's an appropriate amount. And this is, like you, I took it before I go to bed. I had one, and it worked as it should. I felt, a little giddy and happy watching some television, had nice dreams, woke up, was refreshed, didn't have any hangover, any side effects, and it was great. And I put this review in the GreenJeans system. So all that's useful. I can look back at my reviews, see that I did have a positive engagement with that product, and know to use this in the future. Alternatively, I was in Michigan, and I was at one of these industry events, and they were handing out drinks. So I had a seltzer, and I'm not going to name names, but I had a seltzer and drank this and had a horrible experience. And if this would have been my first experience with the product, I would never use a THC product again. So at this point, I already knew that don't waste your CBD on me. There's no point. So I said, just give me the THC version. I drank the THC version, and about 30 minutes later, I had like hyper photosensitivity. I felt increased pain. So these are like increased pain is the opposite of what you want to feel. when you're taking these types of products. You know, so for me, if that would have been my first experience, I would never again use a cannabis product. This is the thing that we're trying to prevent people from having, this experience specifically. So if we know already that a person like me who does not engage with the product either took too much or had certain components in that product that didn't exist in the others, like there are other elements that are in those edibles as opposed to a drinkable that are going to cause you to have a different outcome. And there's another very interesting thing that happens with, do you guys know about the mango effect?
The mango effect.
Yes. So,
No.
so back to that French terpene, this one exists in mango. And if you eat mango prior to engaging with a product that has that terpene, then it enhances your experience with the THC in the product. Because the theory is that it opens the blood-brain barrier and more of the THC can pass through and more efficiently affect your brain, let's say. So it becomes more bioavailable than it would otherwise be. So you're going to have more, psychotropic events, maybe more hallucination. This might not be what you want to have, but it's important to know that this experience exists for people and try to figure out why it's happening. So if somebody comes in and we have, buttons on the platform that'll say, are you under the influence of something else? You have the ability also to take notes. So if you have a bad experience, and let's say it's too intense, if you, Mersin, if you took that and you had a mango before, and all of a sudden you're having a really bad experience with a strain that you otherwise have a great experience with, you can document that and we can figure that out on the back end. Okay, there is a correlation between one and the other, and maybe this warrants more investigation. So
people don't really care about the terpenes; they care about the effect.
Yes, they
right?
do. They care about flavor and the effect.
It's the effect it's the flavor and the effect that matters, and so that's what. So I get it, and that's important. And we're coming up on the end here, but one of the things, a quick question for you because I'm really curious. Are you using like a predictive or generative AI as part of this?
Yes. So our back end was developed by a Stanford bioinformaticist. We were talking, Joy and I, prior to coming online. He's a co-founder, and I'm an MIT guy. We worked on the back end for quite a long time, and it is refined and ready to go. It just needs more data in it. So you can start the predictive model, the knockout model, essentially with the data that's currently available in the market, which you see in a lot of these send us your DNA and we'll send you the profile that you should use products. Yep. That's the starting point. Then you're essentially conducting the largest population study ever on cannabis interactions to figure out down to the individual, how are you interacting with these products and what should you actually be using to better your experience?
That makes a lot of sense. Now, why don't you tell people again, you talked about it earlier, but how can they find out about this? How can they learn about this? And can they just start journaling if they're not a customer of, the direct customer of one of your brands?
Yes, absolutely. So mygreenjeans.com, you can go on there, you can download the app, you can start using and journaling with your own strains. So if you are a home grower, if you're a legacy market person, if you're the black market, gray market, white market, it doesn't matter. You can bring your own strain to the platform. Whatever dispensary you bought it at, you can document that. You can document all of your experiences right now. It is free to join for everybody. There are also rebates available in almost every market now. So if you're on in New York or you're on in Michigan, we are updating the platform coincidentally right now to include more rebates. Those are available to you at select dispensaries that we currently work with. So yeah, get on there and try it out. It's a great experience. It'll help you refine your experience with cannabis, have a better one, and also help people who are similar to you, like your family members, have much better experiences with the products, especially if they've never used them before and they want to try them out and they might be afraid. This is a good way really to convince them to engage with the product on a test basis and de-risk it for them.
So there you go. Have a pot party, bring your laptops, and we'll journal away.
Yes, that's right.
Okay. Well, good stuff, Ryan. Always great to have you on the show. we got to collaborate more. I've got a lot of things going through my head about how we can connect these cool technologies, and really wish you the best. And let's keep working to make this happen.
I agree. Thanks for having me again. I appreciate it. It's great to see you. Great to talk to you always. And I'll see you at the next ASTM meeting.
Sounds great. Take care.